Hi, I'm Rodney Harris, Mayor of the beautiful city of Miami Gardens. Welcome to One-on-One with Mayor Harris, a place for us to discuss things impacting our community. Along with your input, we'll also have special invited guests and experts during each segment to address a variety of topics that's critical to our city. Today we're talking about COVID-19 and how it still affects our residents. We also want to take this time to dispel myths and fact-check the rumors surrounding the vaccine. The City of Miami Gardens launched an unscientific poll to see where you stand. 7% of the people polled say they tested positive for the disease. 66% say they know someone who has died of COVID-19. Positive COVID-19 cases have dropped. Joining me now is Dr. Jocelyn Lawrence with the Jesse Trice Community Health Systems. Jesse Trice assisted many of our Miami Gardens seniors with getting their vaccinations. Also with us is Dr. Sophia Lynn, a licensed emergency medical physician who works at Mount Sinai Medical Center. She's a graduate of Meharry Medical College. Dr. Lynn has been on the front lines of the pandemic since the beginning. Thank you, doctors, for joining us today. And the question that I had was, with spring break going on and taking place, and we see it on the news every day, how bad is it out there?
It's been pretty rampant in terms of diagnosing new cases of COVID-19 virus. Just for example, yesterday there were over 4,700 new diagnosed cases in the state of Florida. I think the important thing to remember is during the spring break time when we're getting people migrating from other states into our beautiful sunshine state of Florida, they are abiding by their individual states' protocols. Please keep in mind, in Miami-Dade, and specifically Miami Gardens, we're mandating masks. Other states might not enforce that, but we're really enforcing that in our county, and we want to make sure that anyone who comes to visit adheres to those rules so that we can respect the boundaries of our county and make sure that we're taking care of each other. That's the only way to get through this pandemic.
Yes. And we're still asking them to follow the proper protocols of the CDC by washing their hands, wearing their masks, and making sure, Dr. Lawrence, that they're getting vaccines from Jesse Trice, correct?
That's
Could
correct.
you talk about a little bit about the vaccinations that's taking place at Jesse Trice?
To date, Jesse Trice has given just about 3,000 persons the COVID vaccine, and we're administering both the Moderna and the Johnson & Johnson vaccine.
That is great. That is great. So should people now, with the vaccinations being in place, should their guards be put down?
Absolutely not. Definitely not. Remember, Florida State has over 21 million people, and at this point in time, 2.4 million have been vaccinated. So it's about average of 10 to 11% of the population of the state. For that other 90% that have not been vaccinated, they're still at risk. So please don't take any decreased measures in laxity in terms of masking or protocol, in terms of social distancing or vaccinations or anything like that, because we have to protect each other. And the only way to get through this pandemic is to make sure we're following all of those guidelines.
Good. And Dr. Lynn, you work in the emergency department of Mount Sinai. Are you still seeing patients coming in, and how young are they?
I see a wide variety of patients. So in my emergency department, it is clinically an adult emergency department who sees everyone. So I get everyone from newborns to elderly patients. It is not specifically a pediatric emergency department, but to speak to the wide range of the variety that we see, a lot of the patients that are coming in from very mild to no symptoms, asymptomatic, to severe respiratory distress requiring intubation. So within that spectrum, the greatest common denominator is fear. What can we anticipate? What should we expect? What is going to happen over the next 2 weeks? So it's important for me to reassure them, especially if they're asymptomatic or lower risk with minimal symptoms. Keep monitoring your oxygenation status. Make sure that your oxygen levels are good. Symptomatically continue all the vitamins and all the things that we've encouraged people to do over the last year that we found that have been successful in helping to reduce and minimize the advance of the symptoms.
And I'll ask this question to both of you. Why do you suppose COVID-19 has affected the African American community so much?
We're a vulnerable population. The things that impact us are where we live, work, and play. We tend to live in more crowded conditions, making the atmosphere right to spread COVID, should one have it. We work in places where we're not able to take off to work from home. We have jobs where we have to be in place, further exposing us to the risk.
Okay. Dr. Lynn?
I think that's an excellent point. I'm diagnosing one person in the emergency department with COVID-19, and I'm sending you home to a household of 7 people. So you can automatically assume that entire household is going to be positive within the next 2 weeks, because it's very hard to tell one person to quarantine when it's a 3-bedroom house for 7 people, and that's a luxury, you know? I can't tell that one person to take that entire space in those 4 walls and not allow anybody in for over 2 weeks. So the distancing and the lack of being able to do that within your own home is a breeding ground. And also, in addition to COVID having an impact on us physically and mentally, it's hurting our pockets. So as you mentioned, to the point of needing to go to work, we don't have the luxury to stay home. Our population doesn't have the type of job that allows them the privilege of staying home. A lot of the jobs that we have to be present on site and be able to activate those services. So we have to try to maintain our health as well as possible.
I know a lot of people say that, oh, this thing is just going to go away. They said that a year ago, and we're still dealing with COVID.
Yes.
So do you think COVID will eventually just go away, or is it here forever?
It's very hard to speak to forever in terms of a virus that was recently diagnosed less than 1 year ago.
Yes.
And the transmission and infiltration into the US. What I can speak to is how rampantly it has infected the entire nation. And what I see and predict is that the vaccine is the only way we'll be able to form some sense of security and containment of this virus. I do not know if it will require once per year, if this will be an annual vaccination, or if this will be once every 5 years. As a scientist, we're still deciding how to administer this and to best keep our population safe. But in terms of prediction, what we're at now is peaks and valleys. After every holiday, Thanksgiving, Christmas, New Year's, gatherings, spring breaks, where large masses are coming together, we're going right back up to our peak for our numbers. As we said yesterday, 4,700 people were diagnosed of new cases in Florida. So we have to keep that in mind. We're improving in general as a state, but we're nowhere near our low point. The vaccine will help us, but will not eradicate it. The only vaccination that's ever eradicated a disease is smallpox. We haven't heard about smallpox in years, and we don't get vaccinated for it anymore because it's eradicated.
Yeah.
But we get tetanus every year, we get polio, we get influenza. Like, you got to remember, there's still vaccines that are actively being managed and administered to try to help contain the virus, but it hasn't completely dissolved.
So, Dr. Lawrence, working with our elderly population, are you seeing more of our seniors? Is the vaccine helping our seniors right now?
Oh, definitely. And I can tell you at Jesse Trice, we've vaccinated close to 3,000 people. And looking at the demographics of that population, 60% of those that receive that vaccine from us are Black or African American, and 30% are Hispanic. So I have to say that I believe that Jesse Trice is a trusted place where people feel like if we're saying yes, get the vaccine, we can come and get that vaccine and know that it's safe and effective. Having said that, a lot of the patients are from our older population. So if they can get it, we're hoping that the younger people will also be able to say, yes, I need to get that vaccine as well.
As soon as those areas open up to allow our younger
Yes.
population to be able to come, we're hoping that everyone is encouraged, especially our college students are encouraged to come.
Yes.
So now, are people getting sick from the second shot and not the first?
No, that's something that I hear quite a bit. The most common side effects from the vaccine are soreness and redness at the injection site, but that's not unlike any of the other vaccines that are given. Some may get fever and chills. Again, that's not uncommon of other vaccines as well. Other side effects might be some tiredness, but it passes.
Yeah.
And I can speak to the honesty because I get the privilege of taking care of patients after the first and second dose. So a lot of people will present to the emergency department saying, I'm allergic to the vaccine. when no, you're not allergic, you're having a symptomatic reaction. That doesn't make you allergic, and you shouldn't feel discouraged to continue and get the second dose as recommended, especially if you've been selected for Pfizer or Moderna. Thank goodness Johnson is one shot only, but if you've been selected for either of the first two vaccinations, it's important that you follow through to get over 95% immunity and obtain your second shot, regardless, unless you're having an anaphylactic reaction.
Now, is there any reason for someone not to get a vaccination?
Yes.
Absolutely, Dr. Lawrence, please take
If they have a history of a severe allergic reaction to any of the vaccine components, they should not get it. If they have a history of a severe allergic reaction to any other vaccine, they are probably not the best candidate to get this vaccine. But other than that, it's open.
So you'll say that the vaccine is relatively safe.
Yes, yes.
And on the FDA website lists the ingredients for each vaccination, Moderna, Johnson & Johnson, and also Pfizer. So if you have a known allergy that you are severely allergic to, go to the website and take a peek at the ingredients listed in each of them. If you see anything that's similar to what you have been allergic to in the past, then you want to make yourself aware of that, notify your physician, and remember there are alternatives, there's 3 options right now. So if one of them don't work, the other 2 might be options for you. So don't completely rule it out. Just make sure you do it in a setting that's appropriate, like a hospital-based setting, in case you do have a reaction. You're always monitored after giving the reaction for at least 15 to 20 minutes to make sure there isn't anything anaphylactic that occurs afterward immediately. And there's also safety hotlines, and you can contact your doctors or present to the ER if needed if you're feeling any symptoms at all.
Okay, all right.
Also on that website, they will list the ingredients,
Yeah.
as you say, but some of those ingredients may be found in other medications that a person may be taking. So that also would be of use to know.
Now, being that there's 3 different vaccinations out there, can someone pick and choose which vaccine they would want to have?
My recommendation is that they take the vaccine that's available to them. They are all effective at keeping someone out of the emergency room and hospital admissions. We offer 2 vaccines given on different days. But again, you can't say which vaccine will always be there. Right
And
now,
what days do you offer the vaccine at Jesse Trice, and what's the qualifications for it, or how would they go about signing up to get a vaccine?
so you would just need to call Jesse Trice if you're not a patient. The number is 305-637-6400. We do follow the recommended guidelines, being if you're 60 or over, if you're a healthcare worker, teachers, and law enforcement if you're over the age of 50, and then vulnerable populations who may have some chronic conditions that need to be treated.
And just to chime in on that, no, the short answer is no. You do not have an option to choose your vaccine. Just like you don't go to the doctor and ask for a particular vendor to give you the influenza shot, you don't go into the Jesse Trice Center and request Moderna or request Pfizer or request Johnson & Johnson. There's no selection process for it. It's based off availability, like Dr. Lawrence said, and what that particular location is carrying.
Okay, now the question is, with both of you guys being doctors, have you had the vaccination?
Absolutely. Yes.
Great, you heard it.
We were first available to take it. So I started my first dose December 31st of Moderna, and my second one in the end of January. So 28 days later, I was able to get it, and completely vaccinated, feeling well, had minimal side effects after the second dose, including all the things we discussed: soreness at the site, a little bit of nausea, and a low-grade fever that resolved in 24 hours, and I was feeling great afterward. Went straight to work, was still able to function. So I just want to kind of dispel some of those fears, like, I don't want to get it because I may get sick. Anytime you inject something foreign into your body produces an inflammatory reaction, and that's all we're responding to, just that inflammation. So it usually lasts for less than 1 to 2 days and resolves on its own, and you're still able to function and work.
So last question to you guys. What would be the message that you would send to our residents to let them know that the vaccination is okay, and just to give them a sense of comfort in knowing that it's okay to go and have the vaccination? And what advice would you give our young people who are out there enjoying themselves right now, and some people not wearing masks? What would you tell them?
Sure. Well, When it comes time to take the vaccine, I would ask them to ask themselves 3 questions. One would be, how many people have died from COVID? And we know that over 500,000 of people have died from it. The second question would be, how many people have died from the vaccine? And we know that's extremely rare. You can't think of anyone who's died from the vaccine. Yet we've given it to millions of people. The third question would be, which would you prefer to take your chances with? Getting COVID and not knowing how your body will respond to it, or getting the vaccine knowing that millions of people have had it and that they've been okay?
Great point. Specifically, I want to talk to my younger population. I got to protect those in particular. I definitely relate to our younger population, and I want to make sure and emphasize the importance of not being a vector, not being the source to spread the virus to other people, whether that be your elderly parents at home, brothers and sisters, in your dormitory, with your immediate girlfriend or boyfriend. You got to remember, it's important that sometimes we feel immune and our younger population feels superhuman, but I've seen so many people, so many people, and the reaction of the COVID-19 virus has ranged from asymptomatic to completely severe in very young population. So please don't take for granted that you can get this virus and it can have severe reaction and symptoms, and it's important that you don't harm others and do all the things that we've discussed. If you have an option to get it, make an educated decision. Talk to your healthcare providers. There's several websites online that are offering excellent scientific-based information to help you guide your decision. So weigh all of your options and make the best personal decision for yourself.
Is there anything else that you would like to add and say to our residents here in Miami Gardens?
Just continue to wear your mask, do the physical distancing, wash your hands, and get the vaccine.
Great points. I would like to say that I know COVID-19 protocol is becoming cumbersome and tiresome, and we're tired of all the PPP and the distancing and the mask, but please understand, through this entire pandemic, we've also gained some amazing new changes in our lifestyle in terms of hygiene, in terms of caring for each other, community support. So it's important that we continue those measures beyond COVID-19. Continue to wash your hands frequently and sanitize regularly. Continue to social distance during flu season and COVID-19 season. And all of those viruses can be spread respiratory-wise. So as long as you can maintain social distance, you minimize that transmission. Take the good out of the situation and those lifestyle changes that we've activated over the last year, and use them, continue to use them beyond this pandemic, because they're only great to decrease the transmission of viruses in general and bacteria in general. So be optimistic that there is a light at the end of the tunnel. When exactly that'll be, we're all working hard and working together to get there.
Yes, we are. Well, I want to take this opportunity to thank both of you, Dr. Lynn and Dr. Lawrence, for coming out and being part of our very first one-on-one with Mayor Rodney Harris. So thank you guys again, and the residents of Miami Gardens, thank you. And if there's anything that we can do as a city to assist you in this campaign to stop this deadly virus, please let us know.
Absolutely. Always here to offer our services.
Thank you so much. Thank you. Thank you for watching, and I hope you were able to learn something from this. We'll be doing this again, and we hope to see you back.